1160 and 101.1 FM, and good morning to you. We're going Facebook Live with Dr. Dan Clark this morning. Dr. Clark is new to the Indiana Regional Medical Center, one of the top robotic surgeons that you're ever going to find, and he's right here at the Indiana Regional Medical Center. Good morning.
Good morning.
So good to meet you here today.
Oh, thanks. You too.
We want to talk a little bit about the capabilities of IRMC's robotic surgery department. That's not the technical formal name for it.
Right.
But that's the area in which you find yourself, and you bring stellar credentials to it, and you come to a place where robotic surgery is not only being performed, but really being performed in a great way. This Da Vinci system is incredible, isn't it?
It sure is. That's actually the equipment is what initially attracted me up here.
Really?
Yeah, because I'm a national proctor for robotics. And when you start a program, you have to have a national expert come in and certify your program and watch your doctors and make sure they're safe with the robotics after they've undergone extensive training to get to that point. Mm-hmm. I'm one of those national experts that they bring in, and I travel the country doing that. And IRMC asked me to come up and certify their program. And I walked into the operating rooms and was just amazed at the equipment and the state-of-the-art operating rooms that they have. They're probably the most state-of-the-art operating rooms in the state of Pennsylvania right now, because they're all brand new and they've done everything perfectly right, and that's what really attracted me initially.
Well, so let me get this straight. You go all over the country, and you actually are the person who walks in and you certify that, yes, this is a good program that's ready to go. They've got everything in line, and the equipment is there, the skill is there, and this is going to be a really good working program. And you come here and you see what they have, and you say, wow, this is a good place to settle down.
Right. That's exactly right. So I came up and I was with Dr. Billen, and I was actually proctoring Dr. Bill Moria and Dr. Guidetti, and they both had excellent skills. And we went out to lunch, and I asked Dr. Bill, and I said, why do you have all this? You know, you got all this, and you didn't even have, people who were using it yet. Uh-huh. And I turned around and looked at me and said, have you ever thought about leaving where you are? And I was very enticed, actually. So,
yeah.
I lived in Western Pennsylvania for 16 years, and so 17 years, actually. So,
well, let's get some background on you. Where do you come from? Where were you raised? Where did you do your medical studies?
Well, I was born and raised in Eastern PA, Westchester, PA, and went to Temple University in Philadelphia for my undergrad, and then I went to University of Pittsburgh for medicine, and that's how I became familiar with Western PA.
Oh, okay.
After that, I had an Army scholarship to medical school. I don't come from a rich background, and when I got accepted to medical school, I said, how the heck am I going to pay for this? And I got fortunate enough to get the Army scholarship. So after medical school, I went out to Denver, Colorado, and I did my training at Fitzsimmons Army Medical Center.
Oh, wow.
And so I've been several places since then. So.
Yeah, well, happy birthday, too, today, because today is the birthday of the U.S. Army.
Oh, thanks.
So with all of that background and all of that experience, and you come here to Indiana, and for folks who aren't aware of what robotic surgery is and what its capabilities are, of course, when you began, I'm sure that the capabilities were nothing like they are now.
That's correct. Yeah.
The technology just seems to advance in leaps and bounds, it seems, every year.
Right.
Explain to people what robotic surgery is and how it enables you to more effectively treat certain conditions.
Well, I think a lot of people understand laparoscopic surgery or minimally invasive surgery, arthroscopic, where the orthopedic surgeons put cameras into the joints and operate that way. Laparoscopic, lapro means abdomen. So we're putting cameras into the abdomen and operating, the way we've been doing gallbladder since the early 1990s, and I've been doing colon surgery that way, taking spleens out, operating on the pancreas and such since the early 1990s using the laparoscope with the small incisions. So robotic surgery utilizes laparoscopic surgery. You just do the same small little incisions, puts the instruments in, but it gives you a lot of benefits that the laparoscopic doesn't. I always tell people, so I have some people come up to me and say, oh, I don't want a robot operating on me, because they envision me just programming a robot and letting it go. We're far from that. And so the surgeon still makes all the incisions, puts all the ports in, the little channels that we use to put the instruments through, and then you put the instruments into the abdomen and attach them to the robot. And it's actually a series of wheels and pulleys. It has a palm that has 4 different wheels on it with pulleys that go down to the instrument. and that matches up with the robotic arm. And then that gives you wristed instrumentation. So unlike laparoscopic, where we have what we call straight sticks, you have straight instruments that go in, they open and close, and they spin. And that's all the level of dexterity that you have with those. With robotic, you have 360-degree motion to the instruments because of the wheels and pulley systems that you control with the robotic arm. So it's like having little wrists in there and little hands in there. You can suture, you can manipulate tissue, you can reach around things, you can suture up, you can suture down, whereas you couldn't with the laparoscope.
Yeah. And the surgeon is always in control then.
Absolutely. Yeah. I'll put all the instruments in. After everything's set up, then I go sit at the robotic console, and then I take control of the instruments.
With that level of precision that you're able to attain, I would assume then that recovery times are greatly reduced, that the effectiveness of the surgery is much more accurate.
It's dramatic improvement, actually, and I'm even surprised because I've been doing laparoscopic surgery for 25 years, and I've been taking colons out since 1993 with the laparoscopic, and I've been doing robotics for the last 9 years. With open colon surgery, you end up staying in the hospital anywhere from a week to 2 weeks after a big incision and all that. With my laparoscopic procedures, we would cut that down to about 5 to 7 days. My average length of stay with colon surgery for colon cancers and diverticulitis is 2.5 days in the hospital.
Wow.
And so it has to be because of the precision and the dexterity that you have. You're not disrupting as much tissue, and so you have a quicker recovery.
Now, you've worked in robotics, what'd you say, for 9 years?
9 years.
9 years. This particular system, the Vinci system, how does it compare to other systems that you've used?
Well, I came out with we actually waited to buy the robot where I was from until the last generation came out 9 years ago, and that was called the SI. The SI has very fixed arms. It extends from a post. You have to position the robot where you want it. You can operate on one angle of the body at a time. The newer system that IRMC has is called the XI, and lots of advantages. But one of the biggest advantages is that the arms extend out from the posts of the robot, and you can spin them over the patient and put them to any direction you want. So, a lot of times we're working, say, down in the pelvis to take care of a rectal cancer. In order to get the colon to come back together, I have to free up the upper abdomen to allow that colon to come down. With the old robot, you would have to take everything out, move the robot to the other side of the table, possibly put in more incisions, redock. And to be honest with you, it took so much time to do that I was quicker doing that part just laparoscopically. Now with the XI, you don't have to do that. You can just reposition it right there where it is and maybe put one other little incision in and then proceed on with the operation with much less time and continue with the precision of the robotics.
We're talking with Dr. Dan Clark this morning in the Indiana Regional Medical Center, and we're talking about robotic surgery, which, as he's been explaining, is something that is not only new to IRMC, but is really top of the line here. Give me an idea of when you first began robotics and the training that is necessary to operate in this way. Was it a process that was difficult to latch onto, or was it something that came pretty naturally to you? How difficult is it for an average surgeon to do something like this?
Well, most general surgeons nowadays do laparoscopic surgery. And so to go from laparoscopic surgery to robotic surgery is not a stretch because you're using the same visualization. You're looking inside the abdomen. But I should also mention the other benefit of the robotic is that with laparoscopic, you have flat panel visualization. In other words, you put the camera in, you have one camera inside the belly, you don't have depth perception, you can see beautiful high-def flat panel like your best TV you've ever seen. That's laparoscopic. With robotic, the other benefit is that you have 3D visualization. So now you put your head down in the robot and you have up to 10 times magnification. So tiny little vessels look like garden hoses now, so that you can suture things that are very small. You can do things robotically that you couldn't do laparoscopic. So when I go around teaching the country, there's, like any new technology, there's always resistance to change. And when I teach these surgeons who are good laparoscopic surgeons, I tell them that if you're a good laparoscopic surgeon, you're going to be a great robotic surgeon because you have all the benefits of laparoscopy, but now I'm going to give you fully wristed instruments, better visualization with up to 10 times magnification and 3D optics. So how does that not make a laparoscopic surgeon a better surgeon? The robot doesn't do anything. I said, if you could give me those benefits without the robot, I don't need the robot.
Sure.
But the way to get them in the current state of the art is only with the robot. So it's more getting used to the controls of the robot and all that. And before you ever operate on a patient, you go through extensive training to get there.
Yeah.
So.
You have talked about several types of surgery, abdominal surgeries that you're able to do robotically. With this system, maybe for folks who don't have an idea of what conditions can specifically be treated, what are some of the other applications that a robotic surgery unit such as IRMCs can do?
Well, if you think of any surgery that is done with a scope, you can do with a robot. So gallbladder surgery, hernia surgery. I do complex abdominal wall hernias. And, it used to be you'd have to make a big incision in the belly. These are for ones that don't come together easily. They've been there for a long time. The muscles have retracted. If you just suture that back together, they just tear again. So you have to go in and free up the muscles and do a rearrangement of the abdominal wall. To do that open, you have to make big, what we call skin flaps, or peel the tissue way back, and you have a lot of dead space, increased risk of infection and fluid collections and things like that. You can now go in robotically and do that internally without the big incisions, mobilize the entire abdominal wall, and do these complex abdominal wall reconstructions with the robot now, too. And so inguinal hernias, ventral or incisional abdominal wall hernias. I do upper GI work, such as for reflux, that's called a fundoplication, the anti-reflux surgery. There's an even more complicated one called a paraesophageal hernia, where the stomach actually flips up into the chest and it's herniated into the chest. I can do that robotically. So basically anything that you can do in the abdomen, there's somebody that can do it robotically. So
people with hernias, they try to live with them for far too long, don't they? I'll just live with it. I'll get it treated sometime down the road. Not necessary, is it?
No, it's not necessary. And then, unfortunately, it's a much bigger operation when you wait like that.
Okay.
And it's much harder recovery, and it's a harder operation to get done and have good success with it, too.
Well, you're here at IRMC now. We're so glad for that. You come to a wonderful department, and it takes not only skilled surgeons, but it also takes skilled assistants within the operating environment, too. And I know that the staff there in the surgery department at IRMC it's top-notch, too.
Absolutely. And they had a great team here to begin with. But I'm very pleased to say that my robotic team left where I was and joined me up here.
Oh, they came with you?
They came with me. And so they were upset that I was leaving, but that wasn't the only thing. There were other issues, and they were looking for a change themselves, and when they heard about what IRMC has to offer, 3 nurses left the operating room where I was who were critical in my robotics program there.
Wow.
And, I didn't really have anything to do with them coming here, but they looked on their own and decided that they liked what they saw here as well. And in the very near future, my surgical PA, who's worked with me for robotics for 4 years almost, is coming up as well. She'll be joining us next year, and that was all her decision as well. Upset that I was leaving, but also worried about the status of the robotics program where we were.
Mm-hmm.
But not only that, they have the surgical team already here is so well trained, and that's the other thing that attracted me. When you're in the operating room, I've seen some not so well trained and you're not so well coordinated teams. And when I came to RMC to Proctor, I was impressed with how good the team already functioned. They were doing their first few robotic cases, and it seemed like they had been doing it for years, because they were so well trained. They have a surgical PA here, Emily, who is fantastic. She's been working in the operating room with the surgeons here for a while, and Emily's been doing the robotics since they started back in October, and I did a few cases with her already, and she's fantastic. So, you already have a good team here in place.
Terrific stuff. It's good to know, and we're so glad that you're with us, and your team came with you, too. Dr. Dan Clark, thanks so much for coming in to visit with us.
Thank you.
We appreciate it. It is Indiana in the Morning, presented, as always, here on the Voice of Indiana County, WCCS, AM 1160 and 101.1 FM, by First Commonwealth Bank. Fox News is